Hello and welcome to another ICS Impulse video. I'm Wendy Cremley-Welsh, the product manager for ICS Impulse. Today we're going to be talking about the VOR tests, or vestibular ocular reflex tests, that are now in the oculomotor module of ICS Impulse. So VOR tests provide the ability to assess the vestibular ocular reflex. The purpose of these two test types, VVOR, which is visual enhanced VOR, or VORS, which is VOR suppression, are to identify the presence or absence of a saccadic eye movement in order to simultaneously test for the coexistence of vestibular and cerebellar pathology, and thus diagnose vestibulocerebellar disease. So first thing we're going to talk about the visual vestibular ocular reflex. This assesses the patient's vestibulo-ocular reflex with visual enhancement. The patient is asked to stare at the fixed fixation dot on the wall. The person assessing the patient slowly moves the patient's head at about 0.5 hertz with an amplitude of 10 degrees in the horizontal plane or in the vertical plane. The patient should maintain fixation on the dot for the duration of the test. This is going to look familiar to you if you are using the ICS Impulse video head impulse test, because this is very similar to our calibration check. The second test, VOR suppression, or vestibulo-ocular reflex suppression, assesses the patient's vestibular-ocular reflex without visual enhancement. The patient is asked to stare at the laser dot on the wall. This laser dot will move with the head. So the laser is actually being presented from the goggle, and the patient is to look at that red dot on the wall and follow it as it moves as you move the head. The person assessing the patient slowly moves the patient's head at about 0.5 hertz with an amplitude of 10 degrees in the horizontal plane or in the vertical plane. The patient will continue to follow the laser dot for the duration of the test. Regarding pupil detection and calibration, these two topics are covered in separate videos. Regarding goggle placement, it doesn't have to be as tight as doing a head impulse test, but you need to make sure the goggles are secure enough so that the goggles or camera are not moving during the VOR tests. Regarding eye video recording, whether you choose to threshold the pupil in pupil location or grayscale, the video recording will be in grayscale. And then the synchronized video can be used to record the patient while you do the VOR test. And lastly, the external monitor. You can actually put the eye up on an external monitor in the room, and then the presentation remote allows you to start and stop the test instead of having to go back to the computer, so you can stay close to the patient. Regarding the external monitor, you need to click the button down here in order to put the pupil up on that second monitor. So let's go to the software. Okay, so in order to access the VOR test, you come over to your navigation panel over here on the left and you click VOR. And then over here in test setup, you have two options, VVOR and VORS. So you want to choose which test you want to do, and then you choose which direction you're moving the head, either horizontal or vertical. And then VORS is the same, horizontal or vertical. You want to make sure you instruct the patient, and then you go ahead and start the test. So you want to make sure they know what to do when you're moving their head. So here's an example of a subject that we tested doing the VVOR test. So as you see, she is looking straight at the fixation dot and we're moving her head horizontally. Now we're going to show you an example where we did a vertical VVOR test. So again, we're moving the head vertically, straight up and down in the vertical plane as we're doing the test. And she is staring at the fixation dot on the wall. So during data analysis, now this data is of a patient with a normal response. So what you have here are the real-time traces. So the orange is the head trace and the green is the eye trace. In a patient who has a normal response, these two traces should lay on top of each other and you should not have saccades present. Now some of these little spikes are eye blinks, and when you do the playback you can see that it'll occur when she blinks her eye, but you do not see any saccadic eye movement during the test. So this is a normal response. For the VOR suppression, again, instruct the patient that now they're going to follow the red laser dot as it moves from left to right or up and down. So you click start, and here's an example of a subject where we did the VORS test. And so you're going to see that, and we're just going to show you the horizontal here as an example, but you move the head side to side, you can see that she's following the laser dot, and then you see the data on the screen. So for a normal response, what you want to see is that as you're moving the head up and down, so the orange is the head trace, and you can see here we're getting some nice head movement, that the eye stays fairly flat. Now some of these are a little bit of eye movement or eye blinks. The eye trace should be flat and not go with the head in a patient with a normal response. Okay, so we're going to play back the data on the VORS response. So when the playback, it's going to play back both the eye and the head trace, as well as the eye video, and as well as the webcam. And you can play this back in normal speed or slow motion. So here you can see we're moving the head side to side, and he's able to fixate on the red dot. So in the info tab for VOR, what you get is first the test type. Was it VVOR, VORS, or was it horizontal or vertical? The operator, the calibration, the test date and time, and then how long did that test take, the elapsed time. So regarding interpretation of this, you need to look at the traces and interpret whether the traces are normal or not. When you go to the test tab, you will see a list of your tests. So here you see we did VORS vertical, VORS horizontal, VVOR vertical, and VVOR horizontal. In your existing patient list, if that patient had a VOR test, you have these little icons in the existing patient list, and this little man here sitting in a chair looking at a blue dot is our ocular motor icon. And so therefore, if an ocular motor test was done, you will have a check mark in that column. So if a VOR test was done, there would be a check mark in that column, or any other ocular motor test. So let's talk about VVOR interpretation. Abnormal VVOR represents dysfunction of 3 ocular motor reflexes: the smooth pursuit, which is a cerebellar function, optokinetic, which is cerebellar function, and the vestibular ocular reflex, which is a vestibular function. Conditions of the compound deficit of vestibular and cerebellar pathology are the spinocerebellar ataxia 3 and 6, Friedreich's ataxia, cerebellar ataxia with neuropathy and vestibular reflexia syndrome, multiple system atrophy predominantly of the cerebellar subtype, and idiopathic cerebellar ataxia with bilateral vestibulopathy. So basically these are disorders that have a combination of vestibular and cerebellar pathologies. And that's what VVOR is identifying. For VORS, it essentially tests the cerebellum and its connections. It basically uses the same neural pathways as the smooth pursuit test does. Patients with abnormal results on VORS will typically have abnormal results on smooth pursuit as well. So that is a central problem if they have an abnormal VORS. And then here are 2 references. One by Dr. David Schmelevitz, cerebellar ataxia neuropathy vestibular areflexia syndrome, and then one by Americo Migliaccio, cerebellar ataxia with bilateral vestibulopathy.